tell you as a nurse what I see with this. So, you bring your clients into a primary care setting, and it's in the end, it's the provider, the nurse practitioner, or the physician who decides what medication they go on, and their perception of whatever the issue is. Because I know there have been times I've brought clients in, and the doctor says, "Oh, they're just ornery, they got diabetes. Let's take care of the diabetes, but that'll be it." So I could use some of these kind of cards to really, provide a quick reference for perhaps other partners of the team or people I'm caring for my clients as a suggestion of, a depression care path. And I really like the idea. That's very, very critical, the importance of the $4 medications, because getting the medications is critical.
Yeah. Well, this Bowen Chung, who's a psychiatrist and is a member of the CPIC Steering Council, he was talking about the availability of medication for $4 a month or $10 for a 90-month supply improved the adherence of his clients who are on medication, because now he can prescribe medications the clients can afford.
Right. He said even homeless folks will try to muster up $4 just to get some medication a month.
So back to the website, then the next set of resources we have are the psychotherapy resources. And let's hope our connection is still working. Yes. So we separated the contents of the therapist toolkit because the therapist toolkit is quite large and it will take a while to download. We ask folks to either be patient or copy it from your flash drives. And the contents will give anyone who comes to this page an idea of what's in the therapist toolkit and whether they really want it or not. This includes the same set of materials we did an overview before with Esmeralda, which are over here. The CBT manuals in English and Spanish, the therapist forms, the contents of the toolkit, and the assessment guide, which is very similar to the quick reference cards we were just looking at before. Screening resources.
Can I just make a comment?
Sure. No, please.
What we hope is when we're doing the community engagement arm training, in that arm we're going to be training therapists from agencies that get assigned to that arm in being leaders in CBT. So that will be videotaped, that training, and that training would then also become posted as something available even to the resources for services. So even if you're not in the arm getting the intensive training, you would have access to, your agency could in essence be trained, because it's very expensive to purchase a trainer to come to your agency. But even if you aren't in the active arm, if we're able to accomplish that, then you will have, in addition to the manuals, you will have access on the website to the actual training programs if your agency decides to use them through the web. So that's just an example of how we're going to try to make sure that if you have the motivation and interest and need to use them in your agency, you can.
And finally, one resource that will be available to everyone in this study will be the resources for service consultation sessions. And these will be scheduled ahead of time. As soon as they're scheduled, we'll post the information on this page, and everyone who's in this study, who's in the Resources for Services group, will receive postcards, emails, letters, faxes, to make sure one way or another folks know about the sessions and join them. So this is one way to get the whole toolkit for each of the main resources for CPIC, which is navigating this navigation bar here. The other way, which I think may be interesting to engage specific providers who are just looking for a quick reference, is the resources dashboard. So I would come in as an outreach worker, and I am interested in learning about how I can fulfill some of the care management tasks. My organization doesn't have a depression care manager, and we don't have registered nurses, but I feel that as an outreach worker, I can fit into those shoes. So there's very short text talking about what the resources are, and I find the Care Manager Toolkit. I find that this, we hope at least, that this will be the easy and quick way to access exactly the resource you're looking for. And this is it for the website. In the Contact Us page, you can tell us what you think and what should be changed and what's working, and we'll keep changing the website and adding more content.
Which is important. Community voice is important. You hear me say that again and again. You rolled your eyes. I just had to say that.
Oh my God, I'm embarrassed.
No. So everything a work in progress, right? All of these resources, adapt them for your own use. Let's make a plan together, adapt them for SPA 4. Tell us what's wrong. We're listening. Our emails are all over the place. And, Ken answers them at like 2 a.m. You'd be shocked. Do some tests on them.